to some guys and men, watching sperm or low semen viscosity is not a problem at all. In fact, it is not a challenge. But some others, especially couples who are trying to conceive and have a baby, it poses a very big challenge or concern to them. So you know you have a watery sperm or low semen viscosity when you regularly ejaculate semen that are thin, less dense, and less viscous as usual. There is this consistency in ejaculating less dense, less viscous, thin, and watery semen. There is a clear difference between sperm and semen. Yes, the two might be used synonymously in some cases, but there is a clear difference between the sperm and the semen. Now, the semen is the vehicle with which the sperm travels. The sperm is a constituent of the semen. That is to say, it's the number of sperm or the quantity of sperm in a semen that determines its viscosity. When there is low sperm count in a semen, it makes the semen watery. Are there reasons why watery sperm or low semen viscosity can happen to a man, or a man can ejaculate watery sperm? Yes, there are several reasons, and this might include low sperm count. Like I said earlier, it is the sperm that determines the viscosity of the semen. So when there is a low sperm count in a man, or when a man is experiencing low sperm count, there is possibility that he will be ejaculating watery sperm because there is a decreased number of sperm in the semen. Another reason is frequent ejaculation. When you don't give your time as a guy to recuperate from your previous ejaculation, you are ejaculating again, like you are ejaculating several times in the moment you're ejaculating several times. So the body is finding it hard to build itself up immediately and produce more sperm. So you have to give yourself a little time, a little break in between the sexual acts so you can ejaculate again for your body to recuperate and get enough sperm to make up the semen and maintain its viscosity. And you can also have nutritional deficiencies like lack of vital vitamins in the body, like your zinc, your folic acid, your vitamin C, vitamin E. These are necessary for the production of sperm. So when these vitamins, when these nutrients are lacking in the body, it impacts negatively on your sperm production, and your body we only produce according to the quantity of nutrients in the body. So nutritional deficiencies, nutritional lack can also cause watery sperm production. Another reason is overhydration. You drink a lot of water, more than your body daily requirement. So when you're overhydrating, when your body is too hydrated, you are also impacting on your sperm production. Yes, while it is good to drink water, while it is good to maintain the normal pH of the blood by taking water, you should also be cautious or careful with the amount or quantity of water you take so you don't overhydrate yourself and lose your sperm quality and quantity. Infections and some underlying medical conditions can also cause watery sperm production, like prostatitis, sexually transmitted infections, and even hormonal imbalance. If the hormones which are implicated in the production of the sperm and semen are not well balanced, if the brain is not able to coordinate these productions of the hormone, it is also going to impact negatively on the sperm production. It is going to impact on the quantity of the sperm and even the quality of the sperm being produced. So the body have to harmonize the production of hormones that are in charge of sperm production. And lastly is lifestyle factors such as smoking, drug abuse, drinking, and stress. Yes, a lot of stress, if the body is overwhelmed with stress, the body may be challenged to produce watery sperm. If you smoke a lot and these toxins impact on your sperm, it may also disfigure or alter the nature or the quantity or the quality of your sperm production. So your lifestyle factors impact on the sperm. And watery sperm or low semen viscosity be treated? Yes, it can be managed, but it starts from you. Yes, it starts from you going to see your healthcare provider and visiting the hospital to be properly diagnosed. Not all infertility is caused by watery semen. Not all infertility is caused by watery sperm. So you don't start self-medicating on something you only assumed. You have to be properly diagnosed of watery semen or watery sperm before getting treatment. So your healthcare provider is going to give you treatment based on what is causing the watery sperm. So if is a lifestyle something, if it's a lifestyle factor that is impacting on your sexual health, you are going to start modifying the way you live. If you are smoking, you may need to limit the amount of cigarettes you take in a day. You may need to limit the amount of alcohol you take in a day. You may need to limit the nature of work. You may need to balance your work and your health because stress, I said earlier, impacts on your sperm production. And if it is nutritional factor, remember I mentioned vitamin E, iron, folic acid, vitamin C. These are essential nutrients that are required for proper sperm production. So if it is a nutritional factor thing, you may need there may be nutritional modifications. You may need to meet your dietitians to plan your meal, to plan your nutritional intake for you. And are there underlying factors like prostatitis, any sexually transmitted infection? You will have to get that treated properly for you to maintain your sexual health and your sperm production. So the management all begins with you getting properly diagnosed. And if you are a woman or a lady or a partner watching this video, I beg of you, your husband, your man, your guy, your couple needs you. At this moment in their lives, you don't need to body shame, you don't need to cajole them into not being man enough, into not being doing their manly job, they need your shoulder to lean on, they need your support, they need your utmost support. You have to be an emotional booster for them. Encourage them to visit their healthcare provider, encourage them to eat well, to rest well, to avoid smoking, alcohol drinking, and excessive stress. That way you become a shoulder for them to lean on. Like I said earlier, you don't have to cajole them, you don't have to make them feel like they are not man enough or make them have low self-esteem of them. These things can be managed, and watery sperm or low semen viscosity can be managed. But again, be an emotional booster, not a tiger in the home. All right. So this is what I have to share with you today. Hope you got value. And until next time, bye.